Hi everyone, my name is Tracy. I'm here to give you a Pilates workout. So hope you're looking forward to doing some Pilates, and we'll get our core stronger, and we'll keep doing stuff to stabilize our shoulder girdle or pelvic girdle so that all the other sports and exercises that you do are really beneficial and your body just feels good. So you ready to get started? So if you want some water, grab your mat or a towel, and let's get started. All right, we're gonna work our core, and let's start by centering. And I want you to sit on your mat, and I'm gonna ask you to just feel like your spine stretching long. And then I'm gonna have you just take an inhalation, and I want you to stretch to the side. I want you to breathe into the side of your ribs so you feel them fully expanding outward. And then exhale. So I want you to inhale, stretch. Exhale, come back. Good. Inhale. And exhale, come back. 3 more. Feel elongation, rib cage out of hip bone. 2 more. Breathing in. Exhale. And 1 more time. Gonna breathe in. And exhale. All right, let's go the other way. Stretch upwards, lengthen your spine, sink your sits bones into your mat underneath you. Inhale, really expand into the sides of your ribs. Exhale, feel the ribs connect down. Inhale, exhale, return. 3 more. Inhale. Exhale, just let that sternum breastbone sink and melt down into the chest as ribs flow down and together. Breathing in and then exhale. Good. Next, take your legs in front of you. Take your hands under the backs of your thighs. Here, this area is lengthened right now. Sink your sits bones under you. Stretch top of head away from tailbone. Now I want you to start to roll right here into the back of your pelvis while maintaining the length of your spine. We don't want to have any sinking down. We don't want to scrunch our ribs together. Rise up out of your sits bones, lengthen to top of head. Curl back, use your abdominal wall, scoop in. Inhale, now feel your collarbones, chest open, lengthen, stretch. Exhale as you peel back behind your sits bones. Inhale. Exhale. We want to make a giant C with our spine. So the C starts here, the C goes here, and the C ends at the tailbone. C. Abdominals draw to low back so you feel the connection all the way through. 3 more. Exhale. Inhale. 2 more. Exhale. Inhale. 1 more time. And inhale. Collarbones open wide. Next, if you want, you could cross ankles. Legs don't have to be crossed really close. You can kind of cross a little bit away so it doesn't hurt your knee joints. All right, shoulders, placement with ears. Sometimes if we sit at the computer all day, we're going to start to feel like our shoulders start to round forward, and it feels like our head starts to slope forward because of the way we're sitting. So pulling yourself away from a computer, you're going to think of the front of the ribs drawing inward and meeting the back of your ribs, so we feel some elongation in your spine. And then let's do something to release our neck vertebra. It's not an exaggerated motion. Draw your chin in towards the neck so it makes space on the other side of the vertebra. So you don't have to stick your chin out forward or anything. So you just start regular, normal position, just however you would be sitting. Pull the chin in towards your neck. Breathing in and then exhale. And you just come back to normal, to regular position. Inhale. I always think of birds walking, how their whole head moves forward, back. So we don't want to jut our head forward like a bird. We just want to draw in, make space at the back of the neck, at the occiput, the base of the skull, and then release. So you just pull back and then release. 3 more. Pull the chin in, just make some room in the neck vertebra. Release. 2 more. Pull back and then release. 1 more. And release. Next, pick your shoulders towards your ears. First, just go straight up. If you have tension, I want you to release the tension through the fingers. Arms are by your side. So you go breathing in and then exhale. Ribs expand laterally. Back of ribs expand. Then exhale. Shoulders rise. Exhale. 2 more. Breathing from the diaphragm. It's a little deeper kind of breathing. And then exhale. When I get into harder Pilates exercises and I really use my deep core, it's like hard to talk and actually do deep diaphragmatic breathing. And it sounds more like like you're just blowing air out through the throat. That's when, like, I'm instructing, but when you're actually doing it, it's a deeper exhale from down within coming out, not just a from the lips or from that throat. Okay, now here comes the next one. Shoulders rise towards ears, then they rotate down back out of your ears. And then you're going to feel the collarbones widen across chest and shoulders. So shoulders up, down, back, away from ears. And we're actually changing the alignment of your shoulders. This is anatomically where it's efficient for us to be at. So if you have to hunch forward or sit over a desk, it's going to take you out of this ideal positioning. And then what happens, then you're not exactly in the right alignment for when you go to do exercises. And if you don't catch it, then you'll go to do exercises and you won't actually be able to stabilize your shoulder girdle. Your arms won't be in a favorable position, and then you overuse like the anterior shoulders or the center part, but not actually the girdle itself. So that's how injuries occur. So we just go up, down, back, away from ears. Okay, let's do a few to the other side now. What I mean by that, elevate, roll forward, release down. Elevate, roll forward, release. Elevate, roll forward, release. Okay, so you should feel some tension releasing from your neck, even without thinking about your neck or trying. Inhale, exhale, 2 more. And last one. Yay! Okay, we're going to go down to the mat now. And I'll give you something right now for your head and your neck. We're only going to move first cervical vertebra. Like if you have any fusion or anything in your neck vertebra and it's lower down, like 5 or 6, or you could still do this one. We're only going to use our first and second vertebra. You just wouldn't over move your neck. It's just a tiny motion. So you bring the back of the shoulder girdle, shoulder blades firm on the mat. You're going to come all the way down. I'm just making sure you can see where my head and my neck are. Yep, you can see. Good. Okay, so there's length down the sides of your neck. And ideally, you're just looking straight to the ceiling. Then what I want you to do, you're just going to tilt chin up. So you see a little bit of elevation there. And then you're just going to tilt your chin down. So it goes up and then down. Up, down, up. I always have a braid in. If I didn't have a braid, it would be a much easier, smoother looking exercise because the braid wants to go boom, boom, right across the back of the head. It's just a small motion, so avoid lifting head off mat. It's just tilt back, forth, you're tilting. Find your ideal range in between those 2 tilts. You're going to do circles like this. tiny little circles, top of nose to sky. This means you're going in just to the second cervical vertebra. And now we're going to do tiny little nose circles the other way. Tiny little circles. Relax your facial muscles. Relax your mouth. Relax your jaw. Come back center. Should feel like there's more of a release now in the sides of the neck. Okay, I want you to float your arms so you have a straight line, shoulder, elbow, wrist, okay? And at the same time, press the back of the shoulder into the mat. And now it should feel like a widening across the front of your collarbones. So that's ideal. Now, those flat, wide scapula, the shoulder blades in our back, they move away from the middle of the spine, and then they come back into the mat. Inhale, they rise. Exhale, they fall. And that should feel really nice again on the sides of your neck. And like the center part of your spine starts to get longer. Releases a little bit. 4 and 3 and 2. Last one. Gently, shoulder blades back to the mat, hands behind head, neck. I want you to keep your elbows from doing this. Avoid scrunching your neck forward, bringing your ears into your shoulders. Avoid that. Elbows stay wide. Cradle your head. Keep that elongation right there in the back of your neck. And then I want you to lengthen top of head away from your tailbone. I want you just to feel the whole entire spine long. And I want you to focus on pulling your abdominal wall in, drawing in like a zipper, lifting under the front of those ribs as those ribs come down to greet all the way towards those hip bones. You're zipping up into your center, and we're making a rib cage connection in the front there. So you lengthen head away from tail, exhale. So if I remember to do my diaphragmatic breathing, it's more of a deeper exhale. Exhale from deep within. That's what it sounds like. But when I'm talking, you might hear me like that because it's just easier when you're talking. Okay, now alternate knee lifts. Knee up, come back down. Keep the length in your spine. Exhale, knee lifts up. Alternate those knee lifts. Straight line across those two hip bones in the front of the pelvis. Exhale. You make sure your abdominals do not push out. Go really deep and elongate them into the spine. Zip up. Exhale. Inhale. Exhale. Inhale for 4. 3 more. 2 more. Last one. Knees are in tabletop, right over your hip sockets. Now, your back is elongated into the mat because we don't want to arch off the mat. And then you're going to do a twist around the center of your sternum, your breastbone. Your knee is still over your hip. And then you're going to take your opposite leg without pulling your pelvis forward. Avoid letting your hip bones roll forward and arching your back off the mat. Keep the pelvis stable right where it's at. Breathe in. Come to the same side. Inhale. Ribs expand now. Inhale, center. Inhale, center. Inhale, center. Really squeeze out that wet sponge on the side of your waistline. Wring it out for 4 and 3. 2 more. Twist from your ribs. Mid-back. Last one. Now inhale, center. Stretch your spine long. Chest is open. Now rotate, point your toes. Inhale, make sure you're not pushing your abdominals out. Breathing in. Exhale. Inhale. Exhale. Breathing in. Exhale. Inhale. Exhale. Good. 4 more. 3 more. Get that rotation. Good. 2 more. Last one. Breathing in. Exhale. Back to the center. Lower head, neck, shoulders down. Now your knees are still right over your hips. Now your 2 hip points, I want you to narrow them closer together. We want our transversus abdominis muscles to activate. They're deeper down than the top layer, the rectus abdominis. We're going to point our toes. Make sure that our hip points don't rock forward. Keep them level to the sky. Bring them closer. Activate the deep core. Now gently tap both feet towards mat. Here's modified. You would go towards the mat. Your feet might not touch, but your back is still long. If your core is strong enough to stabilize, then your feet can touch without lifting up the back. So you just try and see where you're at. There is no right or wrong. It's where you're at. And time helps you get stronger. Time and doing it. So those 2 things together will help a lot. So you just resist, tighten right across those 2 hip bones. 4 more. Inhale, come back up. 3 more. Keep the spine long. Top of head away from tailbone. 2 more. Last one. Come back up. All right, we're back into tabletop. Knees are over your hips. We're going to think of lengthening tailbone away from top of head. Bring hands, cradle head, neck. Remember not to pull forward on those elbows. That's a cheat. We don't want to cheat, and we don't want to pull our head and neck out of alignment. We pull our head and neck out of alignment anyway, just sitting at a desk. So let's not do that when we exercise. It's better to undo the stresses of the day, right? Rather than add to them. We're going to alternate. Now, I want you to think of your ribs pulling down and together for a nice deep connection in the front. We want, if they jut out, it's going to seem like they pop down in here. We don't want to pop. We want them to feel like they're connecting down together. So our middle back has support as well. Lengthen, you lift. You're going to twist. The opposite leg extends. You're reaching elbow towards knee. Bicycle. Get those obliques. Wring out the wet sponge on the side of your waistline. Good. I'm exaggerating the breath to help you, so you breathe. Get all the air out of your lungs. Get new oxygen in. 4 more. 3 more. 2 more. Twist from the sides of your waist. Last one. Come back center. Bring the knees in. Okay, hip opener. Think of a lever from hip to knee. That's the lever. That's what you're going to stir. When you rotate, drive the thigh bone, femurs deeper down into the hip sockets. They're supported. Pelvis is stable. 3, we're just doing 5 each way. Think of a straight line across those 2 hip bones. Keep pelvis from moving. 2 more. The legs are separate from the pelvis. Last one. Around and together. Now reverse. If you've had a hip replacement, keep the 90-90 roll, hip and knee. You don't have to bring knees up higher because you don't want to go higher than your hip socket. So if you've had a knee replacement or a hip replacement, you're going to watch the joint angles so you don't have to like go beyond the 90 here with the knees. 90, going beyond 90 would be bringing your heels all the way to the back. You would just keep the knees bent like that, the knees over hips. 5 and 4 and 3. 2 more. Circle around. Keep your pelvis stable. Last one. All right. Now, we're going to do something hundreds, but we're not going to do 100 of them. I want you to feel all of your ribs. They expand sideways. When you get the air out, it's like you're going to wring out the wet sponge in between each rib. Those are your intercostals. And it all connects down here in the center. We want to get that nice connection. And it's like a cage. Your rib cage is a cage. When we add utilize all the muscles. We're using our intercostals, our internal external obliques, our transverse abdominis, and then we think of drawing like a triangle, thumbs to navel, index fingers below navel. That whole triangle area pulls deeply towards spinal wall, and it stretches and lengthens up, and you zip it up as you're pulling the sides of those ribs down together. That's your rib cage connection in front. That's your cage of support. And when you get all those muscles firing, there's nothing you can't do. If you could support your entire body from the center, then you'd be stretching your arms away, your legs away. So any sport you're doing, it's all coming from the center, rotating out, like a force moving out of your center. So now, remember how you peel head, neck, shoulders up with the length, and you're scooping in, you're drawing, you're lengthening. When we do 100, keep head down while I explain. You don't want to have your arms flapping. You don't want your wrist out of alignment. You want to extend. Plug that arm into the back of your shoulder blade. So remember the up, down. Arm is plugged into your back. Do the other side. Plug it in. Now, you're going to imagine reaching from the armpit through the palm into the pinky to activate the muscles right under here. Neck is long. Look towards knees. Now, without moving your head, your neck, or your shoulders, move your arms. Breathe in. Now, inhale. Ribs expand laterally. Now, exhale. We want to pull those ribs to the center. We want those intercostals to start wrapping around. Inhale. Now, head's not moving. Inhale, 4, 5. Really scoop deep and zip up under the front of those ribs. Breathing in. Now, really work your ribs. Connect them down in front. Breathing in, reach from armpits to palms. 3 more sets. Breathe in. And exhale. 2 more sets. Breathing in. And exhale. Last set. Breathing in. And exhale. Excellent. Come back to your mat. You're going to bring one knee into your chest. And just allow your head, neck, shoulders to relax for a second. When we do our single leg stretch, it's about the knee staying in line with our hip socket. Mid-knee is over second toe. We're working on our alignment, our kneecap alignment, our thigh bones. So every time we go to pull our knee in, we guide inside hand, inside knee. You're guiding, keeping the knee in line with your hip socket. And then the outside hand is going to guide that ankle. You keep chest open, your shoulders are down and back, away from the ears. When you roll up, remember that long C from the top of the spine to the tailbone. You breathe, you inflate the back of the ribs even. Then you're going to take your opposite leg in the air, point your toes. Now make sure that you don't arch the low back off the mat. Hip points face up. You drop those shoulders away from the ears. Collarbones are wide. Chest is open. Now think of wringing out a wet towel across the sides of your waist. So you're going to stretch leg far and away. And then you're going to stretch the other leg far and away. Now, I think I'll just do single breaths. Breathing in. Now exhale. Breathing in. Now exhale. Really scoop deep. Zip up right under that navel. From pubic bone to navel. Zip her up. Chest is open. Shoulders away from ears. Zip her up. Those ribs connect together in front. Inhale to the sides and back of them. 4, 3, stretch and reach. 2 more. This is going to make heat in your body. So you should be feeling warm from the center of your body. And last one, single leg stretch. Knees draw in, And just release that low back for a moment. Now, anchor your shoulder blades all the way down into the back of the pelvis. Shoulders away from ears. So remember, if you've had a hip replacement, you're going to do it with your knees out here more. You're going to keep that line, hips to knees. Collarbones wide. Think of elongating, tailbones heavy on the mat. The head, the neck, the shoulders come up. Exhale, you pull the knees in. Now, breathe in, you reach your legs long, keep core strong. Exhale all the air out of the lungs without the back arching off the mat. So you're going to breathe, stretch those arms. Exhale all the air out of your lungs. Breathe, arms go right by sides of ears. Exhale, back is long on mat. Exhale, shoulders away from ears. Breathing in, exhale, and 6. Breathe in, keep that back long on mat. 5. Breathe in, those ribs expand, they knit together. 4, they connect right in the front, they pull around. 3, expel all the air out of the lungs. 2, last one, breathing in, exhale. Excellent. Now, this next exercise, make sure when you bring your foot down, you don't have your heel way in here, and you don't have your heel way out there. When you do a bridge, you're going to have knee and hip, knee, ankle, place the foot down, place the foot down. I'm just making sure I'm even. Look at the center of your kneecap and align it with your second toe. And then be careful if you have any structural habits. If you're used to like letting your knees pull together, or if you're used to like having one leg go sideways, really focus your hip alignment and your knee alignment over the second toes. I want you to press through your palm, your index finger, your thumb, and your pinky. And then I want you to widen your fingertips. Push, lengthen down to the mat. There's a shelf across your mid-back, your shoulder blade shelf. We're pressing through there. No pressure in your neck at all. We never put that pressure into the neck, okay? Now, your 2 hip points come closer together. Activate that transversus. Now, from pubic bone to navel, you're zipping up. You're lifting from back to front body. Zip her up, get that vertical lifting effect. I want you to engage your glutes so we don't overuse the backs of the thighs. We want them to work together, a coordinated effort. You're going to breathe in, and then you're going to push down into your feet. Feel elongation as you press your hip bones to the ceiling. It feels really nice if those 2 hip bones press up. You can feel the stretch. Keep the middle of those knees over second toes. Avoid letting those knees fall out to the sides because you lose some of the control. Now your pelvis is going to come down at the same moment. Imagine you have a glass of water. You don't want to spill it. Be careful you don't roll one side before the other. Go straight up. Exhale. Work those glutes. Connect into the backs of those thighs. Push down into your feet and lower down. Now let's try something else. Think of your sternum pressing to the sky. When your sternum press up to the sky, feel your blades widen across your back even more. Sternum lifts to sky, collarbones wide. Feel those blades widen across mid-upper back. Now lower straight to the mat. Go, we're just letting your body adjust as you go. Go straight up, scoop and lift, straight back down. Straight up, engage those glutes, fronts of thighs, press hips to sky, straight back down. Lift your sternum, your breastbone up so those blades are flat and wide. Keep neck long. 4, straight up. You're doing it. Straight back down. 3, make sure hips hit simultaneously. 2 more, straight up, straight down. Last one, they go up and then they come down. Now, sometimes we have different recruitment of muscle patterns. Maybe one of our glutes is shut off and we don't even know it. Take one leg in the air. You can modify this by bending your knee halfway if you like. Here's modified, okay? Here is harder. Just keep leg right over your hip socket. Tighten the belt across your two hip bones. Lift your sternum up. Feel those blades wide across the back. And at the same moment, front ribs meet back ribs. Push down. You're elevating up. And then come straight down. Hips are level and stable. Straight up. Straight down. Lift and down. You can modify this by doing a second set with both legs. If you're not stable on both legs, go ahead and work on both rather than doing single bridge. Exhale, inhale. Work on bringing your hips down at the same moment. I want the front of your ribs to meet the back of your ribs so you don't arch your low back, okay? And 4 and 3. You don't have to lift real high. 2 more. Last one. As you get stronger, you'll lift higher. Fold the leg. Again, here's modified. Your leg is bent. Here's harder with your legs straight. Hip points are straight all the way across. Front ribs meet back ribs. Palms, index fingers, thumbs, pinkies. Push. Collarbones wide. Lift sternum. Front ribs meet back ribs. Push down into your foot. Elevate. Make sure that one hip doesn't swing out sideways. If you have a hip swing out to the side, really start to go into the side of your glute, horizontal fibers, and squeeze. If your hip starts jutting out to the side, you need to activate your glute medius more. Straight up, straight down, okay? Straight up, straight down. 5, 4, I did a little compensation and part of a couple of these I felt it. 3, I started to swing my pelvis to the side. 2 more and get a hamstring cramp on the left. So you have to really focus on what you're doing, because if you let other muscles activate, things get off center. Last one, straight up, straight down. Awesome. Okay, we're going to turn to one side now. So, whenever we do anything on our side, here's what you need to look out for. If you get tired or if you start to get lazy and you want to cheat, you kind of let your shoulder go into your ear, and then we don't want that. We want to keep the space along the sides of our waist long, and we want to keep the distance here. And we want to make sure that we don't get lazy and, okay, let's just go through the motion, because then you're going to not do justice to your neck. And you got to stay connected under the armpit. Stay connected. It wraps on the side here, and then it goes under your shoulder blade, and it stabilizes